Hi, I'm Dr. Dawson. Earaches or otitis media is probably the most common bacterial infection that we see in pediatricians' offices. So I'd like us to talk a little today about what causes them, what we do about them, and why does it seem like there's more ear infections now than there used to be? So first of all, if your child's not running fever, their ear hurts, and they've been swimming a bunch lately, that's probably not otitis media ear infection. That's usually a swimmer's ear. They don't need to be on oral antibiotics, and some drops that you get from your doctor to put in there can fix those up. What we're talking about here is a child who's had a cold for a few days, they're sick, all of a sudden they seem like they look worse, they're running fever, and their ear hurts. That's what we're talking about today. So let's talk about how it starts. I've drawn you a picture. This is a picture of your outer ear canal, your eardrum, the middle ear space, and this is your eustachian tube going down to the back of your nose. So the eustachian tube is the important thing that we're going to talk about here. It's just a little tube that lets air go from your nose to this middle ear space behind the eardrum. And the purpose for that is to keep the air pressure the same on both sides of the eardrum so that your eardrum can flutter. If you swallow right now, you can hear the air go through there and you can hear both your ears pop. And that little pop is that air going up that eustachian tube and coming out behind the eardrum. And like I said, if that works well, keeps the pressure the same, everything's going great. But your child gets a little bit of a cold and your nose, the lining of your nose kind of swells, and that makes the lining of this little eustachian tube kind of swell. And when it's swollen, the air can't get through there as well. So now we have a space without any airflow. And the interesting thing about this middle air space is it is kind of like your lung lining in that it absorbs the oxygen out of this area. So when it absorbs the oxygen out, you're left with a little bit of like a low pressure area on your weather map, and that then will pull back on this eardrum from that negative pressure. And the only thing your eardrum really responds to is stretch. And when it's stretched, it hurts. So if you've ever been to a swimming pool and you dive down 8 or 10 feet and that water pressure is pushing on your eardrum and making it stretch, you know that that hurts. So if you go to the doctor, he'll look in there and he'll say, well, your eardrum is pulled back or retracted, but I don't see anything. It looks okay. Well, if that stays, that low pressure stays there, it then will start to pull a little bit of fluid from the surrounding blood vessels. That will then create this kind of clear fluid level back there. And then if you go to the doctor, he'll look in and he'll say, well, I can see your eardrum is retracted. And if you've looked at about 5,000 ears, you can get where you sort of see through it. It's like looking through wax paper. But he said, I can see some clear fluid. Sometimes even when a little air gets up here, he'll even see some bubbles in that fluid. And he'll say, so this is called serous otitis media, not serious otitis media, serous. The word serous means clear fluid. So that just means you have some clear fluid. Still don't need to do anything. We just let it go away as the cold resolves. Now, sometimes when you have this clear fluid sitting in there for a few days, it's like having sugar water sit on your kitchen counter for a few days. Things start to grow in it. So then we get some little bacteria growing in this serous fluid, and then that turns into infection, and then we get pus formed and essentially an abscess, which then pushes out on the eardrum, pushing it out and making it stretch, causing pain again. Now when your doctor looks in there, he says, you have otitis media. This is an infection. Depending on if it doesn't look too bad, he may say, let's just watch it for a few days and see if it goes away by itself. Keep in mind, there were children in ear infections before there were doctors and antibiotics. So most of the time they will go away by themselves. I'm not saying antibiotics can't make them get better quicker, which is nice, but there were children before there were doctors. In any event, he may decide it looks bad enough to go ahead and put you on antibiotics right away and start killing those bacteria. Now, maybe 1 out of 15 times there'll be enough pressure from this pus pushing on this eardrum to actually break a little hole in it, and then the pus will drain out of the ear, and you'll see this pus-like substance. Sometimes it even have blood in it running out of your child's ear. Sometimes it doesn't smell too great. Even though that sounds ugly, it's really kind of a good thing. This is essentially an abscess, and an abscess on any other part of your body, if you can drain it and get all the pus out, most of the time the abscess will go away by itself. And that's true here too. 9 out of 10 times, just by this eardrum draining, the ear infection will go away by itself. Now, if you had a grandma, she told you that if you have a hole in your eardrum, you're done, it'll never get better. That is not true. This is just like if you had a little tiny hole in the skin on your hand, a little cut, it normally heals up on its own in a couple of days. So that's not something that you normally need to worry about too much. So that's how ear infections work. There's a couple things I want you to keep in mind. One is that ear infections normally don't just come up out of the blue just in just a matter of minutes. Normally you'll have a child that's had a cold for 2 or 3 days while we're letting the fluids collect and the secondary bacteria growth happen. So it's normally on about day 3 of their cold where all of a sudden they'll start running more fever and looking worse and maybe having the ear pain. And that's the normal course of a normal ear infection. Normally it doesn't just come up all of a sudden out of nowhere. The other thing is, even after you've treated your infection and it's gone away, parents tend to want to think that as soon as the fever's gone, that everything's back to normal. That's not really how your ears work. It's kind of like a sprained ankle. If you sprain your ankle, it's not well tomorrow. It's not well a week from now. It's not even well a few months from now. It takes a while for it to get back to normal. And during that period of time, you better be really careful not to sprain your ankle again. Well, the same thing is true of your ears. I would say it takes them about 2 months after an ear infection to get back to normal. And during that 2 months, if you get another cold, you're more likely for it to turn into an ear infection again, because all those things are still swollen and not working as well as they normally do to protect themselves. So that's why you'll have some friends that sometimes seem to get in sort of a spiral of doom where they have one ear infection and then they can't seem to get out of another few weeks. They have another ear infection and sometimes they get in that sort of spiral of doom. So it just takes probably 2 months to get back to normal. So the other question is, why are we having seemingly so many more ear infections now than we used to? Everybody wants to blame, microplastics or the government. But I think like most big changes in medicine, we can frequently find the answer in cultural changes. Keep in mind that 90% of ear infections occur in children less than 2.5 years old. That's because, as we've seen from the picture, if all your parts in your eustachian tube, if all those things are smaller, it's much easier for them to get plugged up and for this whole cascade to begin. As you get bigger, your pipes are bigger and big pipes just don't plug up as easily as smaller pipes. So when I was a child, we children didn't socialize that much. My only buddy was my next door neighbor, and that's about the only person I socialized with. And if he wasn't sick, I didn't catch a cold that might turn into an ear infection. Nowadays, children socialize at a much younger age. Much higher groups of children go to daycares and Mother's Day out and those types of situations where they're in contact with other children. They go to the playground at McDonald's, which we didn't have, where they're in there with other children, and they just pass a lot more germs at a younger age, and they catch more colds before they're 2.5. And so a lot more of their colds turn into ear infections. In my day, we didn't really catch those colds till we were 5 years old or went to kindergarten. And by then our pipes were big enough that they didn't turn into ear infections. So I think that's why we see more now. I don't know that there's anything we can do to change that, but now you at least understand how they work and why we treat them. And I hope that'll help.